So hi there, I'm still at the Sachs conference in Basel. I'm here with Mark, who is a serial biotech entrepreneur and the co-founding CEO of Complix. So it's a Dutch biotech company developing a new generation of biological called Alphabodies. And so with Alphabodies, you are one of the few companies in the world where you're able to target intracellular targets with biologicals. How are you able to do that?
Yes, in that respect, Complix is quite unique due to its technology. Our Alphabodies are in fact small protein therapeutics, but with the capability of enter through membranes and enter into cells directly, a bit like small chemicals. And in that sense, Alphabodies combine the advantages of a small chemical going into tissues and into cells and target intracellular targets, and at the same time they have the specificity and the affinities of an antibody. So they combine the best of both worlds. And that's been technically possible due to the work we have done at Complix in developing this Alphabody scaffold, which has a pretty unique structure and enables these small proteins to transgress through membranes and then get into the cells and address the intracellular targets.
And how does that compare also to Nanobodies? I mean, you co-founded Ablink, so I guess you know it well. Is it really just the target you can have that is different, or how is it different?
No, the difference is much more than that. In fact, Alphabody technology is entirely different than what you call nanobodies. Alphabodies have an entirely different structure. They are composed of 3 alpha helices in a small coiled coil structure, and it's that structure in particular that gives them the ability to penetrate through membranes. And of course, through many years of work, we fine-tuned that technology and we engineered the sequences in those Alphabodies in order to optimize that cellular penetration capacity.
That's great. And I guess thanks to the technology, you were able to raise really good capital. I think total 26 million, and you have EdRip and GIMF as lead investors. So how was it on the financing side?
Yeah, so up to now we've raised approximately 27 million euro in venture financing through several rounds, and indeed lead investors of the last round were GIMV and EdRip, Edmond Rothschild Investment Partners. In that sense, we have been quite successful in raising venture money. We also got some additional non-dilutive financing through several subsidies that we acquired from the Belgian government and the Luxembourg government, more than 5 million. So in total we've raised more than 30 million in order to develop this fantastic technology that we are now applying to a number of quite interesting and promising intracellular targets to develop new therapeutics.
I was about to ask, so how are the clinics going?
Sorry,
how is the clinics going?
Well, we are still in the preclinical stage, and of course we have chosen a strategy where we don't focus on a single product. We have, as I said, a broad platform. It's broadly applicable, and because we can enter the cells, there is a whole number of very interesting intracellular targets that are not accessible to small chemicals. Let's put that clear. And so it gives us a unique position to address those targets with our Alphabody platform, and it allows us to develop a number of programs in parallel. And we are doing that in order to come up with a portfolio of programs that all show that we can apply this technology to challenging but mostly interesting targets, and then use these either to further develop them ourselves or to partner some of them with big pharma companies. Like we've done actually with one partner we're collaborating with today, which is MSD.
You just announced you expanded the partnership, so
yes,
can you tell more?
Correct, yes. So we started a collaboration with Merck Sharp & Dohme about a year and a half ago. It actually went very well, extremely successful collaboration, and about 2 months ago Merck decided to expand even the collaboration, make it broader, and we're pretty happy with how things are going. We are progressing very well, and they're an extremely good partner to work with, very collaborative, very open-minded, and we like it a lot.
And I guess now with checkpoint inhibitors, it's a great partner to work with.
Absolutely, they're a leading company in the oncology area because the partnership is indeed about cancer targets, intracellular cancer targets. And Merck is a leading company in that field, They are extremely knowledgeable and they're very science and technology oriented. So they're a great partner for us. Yeah.
Great. So good luck with Complix and have a nice day. Thank you very much.
Yeah.